Hi, Scott Pop here for Mobility Minute. We're going to talk about disc problems. We have an epidemic of degenerative changes in the disc because of our modern society and excess sitting and poor nutrition and lifestyle. The disc is a pad between two vertebrae. Every vertebra in our body has a pad between it, and in the middle of the pad there's a little ball of jelly called the annulus. This annulus is essentially a ball bearing that allows you to move in all directions. What happens is that the weak spot to our disc is to the posterior. The least amount of pressure to our disc is laying down, the middle amount of pressure is standing, and the greatest amount of pressure is sitting. What do we do in modern society? We sit, sit, sit. We sit excessively. Add to the fact that our disc doesn't have a blood supply. So, essentially the only way it gets nourishment is through movement. It's called fluid migration into the disc with movement that gives it its nourishment and nutrients so it doesn't break down. If we sit all the time, it's like putting a tourniquet on our disc. Add to the fact that we sit with really bad posture, especially in a slumped position. This allows that disc fluid to migrate posterior. So to combat all of these things, to keep your disc healthy, remember, first off, alignment. Arch your back, pull in your belly button, get your chin back, sit at the edge of your chair. That produces the best alignment for keeping the disc forward. Make sure you drink lots of water and keep yourself hydrated. And in the process of sitting, move. Move your torso back and forth. Move side to side every 15-20 minutes. Then get up, walk. The gait motion is really helpful for reducing the migration of that disc bulge. And squatting. Squatting, the act of squatting up and down. Get all the way down and just hold there, come back up. So walk and squat, drink lots of fluid, and if you're diabetic or smoke, get control of those. Smoking is like taking a tourniquet because of crappy blood supply. Again, to the disc, we know through research that smokers have a lot more disc degenerative changes, and diabetics, again, have poor nutrition to their discs. They break down. So diabetes is 100% preventable. That is type 2 diabetes. So lose your weight and get control of your diabetes, and you can get it into remission. So taking care of your disc requires exercise. Go to the gym, get active, walk after work, lift things, be as ruggedly active as you can. The nemesis to the disc in our modern society is inactivity and sitting, poor posture, and poor nutrition. So to reverse all those things, do the opposite, and you'll have a healthier disc, and as a result, less pain. So I hope you like this Mobility Minute. We'll see you next time. Thanks.